Hello, my name is Alistair Hunter. I'm a hand, wrist and elbow consultant. I'll be talking to you today about trigger finger. I work at St John and St Elizabeth Hospital and my clinics are here on Mondays and Thursdays. So what is trigger finger? It's a very common condition, almost the most common that I see. And the main symptoms are pain in the palm of the hand and also the symptom of locking where the finger gets stuck in the palm and the patient either has to stretch the fingers out to release it or pull the finger out of the palm, and this can be very painful. Now this can be a short-term symptom, so lasting only a few days or weeks, but it can be a longer-term problem that starts to affect patients' enjoyment of life. So the symptoms can be so bad that patients avoid gripping, such as when they're cooking, opening doors or playing sports. So let's understand why patients get trigger finger. Well, here's a hand model. And this is the palm of the hand. We can see here these blue structures running up towards the end of the fingers, and these are called tendons. These are the structures which start off as the muscles in the forearm and then reach up into the end of the finger. Now, as they go through into the finger, at the level of the palm, they go through a tunnel, and that's called the annular pulley. This pulley can become thickened, or the tendon itself can become inflamed. And as the tendon runs up and down inside the tunnel, it doesn't glide nicely and this causes the pain. More so, it can cause the locking that occurs. So what do we do about this? Well, for the more mild symptoms, for the pain, taking some simple anti-inflammatory medications can help. And sometimes avoiding of heavy gripping exercises can also help if it's more of a short-term condition. But in the more moderate to severe cases, treatments such as wearing a splint at night, that can, in some patients, avoid the presence of the locking in the morning that is so difficult when they wake up. However, in the longer term, that doesn't really represent a good strategy. And so the next option in terms of treatment would be a simple corticosteroid injection. The injection is performed in the clinic, and that would be something I would offer. The advantage is that it settles symptoms down completely in around 70% of patients. So very good success rate. And it's low risk. Patients walk in and walk out of the clinic, and it takes a couple of minutes to do. If that doesn't work, or if the symptoms come back again and again after injections, then we offer surgery. And that's a very straightforward operation performed under local anaesthetic as a day case operation. It takes 10 or 15 minutes with a bandage around the hand to recover and some exercises with the fingers. Patient satisfaction from that operation is very high, around 90 to 95%, and the risks are low. And so generally, if the first options, such as the injection, don't work, that is a great option too. Afterwards, I would refer patients to the hand therapists, so the specialist physios at Johns and Lizzie's, and they would start some finger exercises and make sure that patients have a smooth and successful recovery. The whole aim is to get patients back to doing the things they enjoy and to reduce the pain. And generally speaking, you have these symptoms and it's bothering you, best to get it checked out quickly. So speak to your GP or contact the hand unit at Johns and Lizzie's, and we can arrange an appointment very easily for you. Thank you very much.